preaching to the choir here, okay? I mean, we've got doctors here that volunteer now and put a lot of time in. We've got some that have volunteered over the past 4 years and maybe have lapsed for a while. We're hoping to have you come back. In many regards, the HealthNet Dental has been very successful. I mean, we started out treating 1,400 patients. The first year we're down to 1,050 patients this last year. Our fiscal year runs from July, and so we're in our last year of the funding from Delta Dental. And Gene has just written a grant proposal and submitted it to Delta Dental for an additional $500,000 for $100,000 for 5 years. So one of the things that we do is every year we award an award to we call it the Caring Heart Award, and we give it to a dental volunteer that we think has really gone above and beyond in helping the patients in Rock County. And this year it was awarded to Denny. So, you know, I think. If our numbers continue to decline, we're going to lose our funding. And these patients are going to be showing up in our office. And we're going to be taking the hit because not all of them can afford the dentistry that we provide. And originally, that was one of the things that I had in mind when I originally proposed this, was that, you know, when I help somebody and I know ahead of time that I'm helping them out, they're grateful and I'm feeling good about myself, you know. Whereas when you or I help somebody out, you know, we've all had those patients that have said, yeah, doc, I'll pay you, I got the money, and then they don't pay you. And 6 months later, we look at the accounts receivable and say, why isn't so-and-so paid? You know, you're pissed off, and they're made to feel kind of like a crook, you know. Donated Dental Services needs help. And I don't know if you saw the April issue this year. If you look at the statistics county-wide, and I think this is damning for Rock County, the statistics are right down here. And Rock County has the longest waiting list and the fewest dentists by county in the state. And we're certainly not the smallest county in the state. And, you know, we're not talking about doing as fine a dentistry as we can do in our office. We're talking about making somebody's day. You know, this guy here, this was Tom, and I asked if I could take a picture after I made him a flipper, you know. I mean, put some teeth, made it an acrylic flipper at my office and gave it to him, and he's all smiles. You know, I mean, he's loving life now. You know, he's got some teeth, he can talk to people, he's a nice guy. All these people are very appreciative. We have a part-time hygienist, Wendy, who's been with us now for over 3 years, I think. And Vanessa, who really kind of runs the show, is the dental assistant there. She's got the hardest job. I mean, you can imagine working with, you know, 10 to 15 different dentists. I mean, it's amazing. Originally, when we set this up, you know, I was worried that, boy, you know, somebody'd look at my filling and someone's mouth said, who the heck put that in? But, you know, that doesn't happen. I never see anything like that, you know. And we're just working to make it better for people. So, you know, we sign up on a schedule here. This particular month, Paul, you've been there for months. You know, we've got 6 dentists working it right now each month. Paul's there, Denny's there, I'm there, Old House is there, Terry Sisler's there, and Jeannie Rowland is there. That's it. You know, we've been running that way for 2 or 3 months now. You know, I've been doing 2 or 3 times a month myself, and Old House has been there a little bit more too. So what we're asking is that you would please consider, if you were doing it, to consider trying to get signed up and doing it again. You know, if you don't feel that you've got time for once a month, perhaps every other month would be just a huge help. You have to remember, we've got these employees, Vanessa and Wendy, kind of counting out a paycheck here too. You know, this is their employment. If we were to lose them, we'd really be in a pickle. Exciting. So, you know, I think that there's a perception, and it is a little bit, you know, it isn't our office. We all have nice offices that we're very familiar with. But, and it's certainly more comfortable treating patients in my office than treating patients at HealthNet. But you get by, you know.
Yeah.
Initially, it's a little bit like the first day of dental school, you know. Don't you think? I mean, what's your...
Yeah, right.
It's not bad.
It's just, you know, there's
Not quite that bad.
You're all right-handed. That's why.
Oh, yeah.
My way. It's
Yeah.
always a struggle for me.
Well, you use all
I did it.
it's
Not that much. I use
But
all
I mean,
mine.
don't you guys use discs anymore? I can't
Right.
find any sandpaper discs, you know, I gotta look at it. What do you guys
I
polish?
bring a bag of my own stuff.
Right, and so, I mean, the reality of it is that some dentists are, you know, I bring my loops and my light and my curing light, because I like my curing light, and I bring some segmented arches for doing composites and that. But, you know, and other people bring, you know, 557 burrs or whatever. But, you know, you can do that there. And
I bring my own assistant.
Do you?
Ed brings his own assistant.
I tried to talk mine into it,
Right.
but she
Help,
wanted me to
it's
do it.
just
Yeah.
not, hardly in a way.
Correct.
It's harder for her than it is for me, because she's open the doors, I know where things are, I'm like,
You know, it really, I guess what I would ask for you, those of you that haven't tried it, you know,
Do it once.
Dick Holthouse said to me the other day, he said, I really enjoy going there. You know, it's not the office, you know, it's something different. It's a relaxed schedule, you know, typically, because for the most part, you're working out of one operatory, so you see one patient an hour.
Check.
There isn't some, and if Wendy's there working there, but you know, there isn't some urgent need to, you know, produce. You get done what you need to get done. It isn't, it's typically, you know, I take a lot of pride and hope in the fact that initially when we start out, we saw patients that needed full mouth extractions, 15, 20 teeth extract. We're not seeing that anymore. And that's reflected in the numbers. If you look at the numbers, we were doing a lot of extractions first year. Now we're not doing as many. We're doing more restorative. We weren't doing as much. We've got Dave Bellardi, for crying out loud, donating time. He came and worked there and he said, well, I don't know if this can work out, but I will see 2 patients every other week in my office, in his office. I mean, that's a real cool, you know, you get the endodontist to do that. I mean, so,
You should tell him about this in kind.
I plan on it. You know, I mean, I just found out about this week, so, you know, I just hope everybody would consider at least giving it a